You are tuning in to McLaren Port Huron Today's Health Program, and today we are talking about surgical options for women for weight loss. And Dr. McFarlane, we're going to speak about the gastric bypass procedure. So can you tell me a little bit about that?
Absolutely. The gastric bypass in itself has been around for a very, very, very long time. In fact, we call it the godfather or the grandfather for weight loss surgery. It's over 60 plus years old and actually still a very good tool today.
And so can you explain what that procedure is?
Sure. Let's look at the diagram, shall we? So when I describe the stomach, just to give a frame of reference, imagine looking at the palm of your hand. And usually your stomach is from the tip of your middle finger to your wrist. Open up your palm, and that's a pretty wide stomach, if you will. So what we do with the gastric bypass is that we're creating a smaller pouch. We call it a restrictive procedure. Okay. Similarly with the band, we call it a restrictive procedure. So we're making your new stomach the size of a large size egg. That's barely 2 tablespoons of a bite and you're full. Okay. The other portion we add with the bypass is called malabsorption, meaning the calories that you take, it will not be immediately absorbed into your body. For that reason, the combined restrictive and malabsorptive gives you the most weight loss when you compare all three together. Okay. If you see over to the next portion of the diagram, we also call it the Roux Y procedure because it looks like a Y once we do the rearrangement. No parts of your body is removed, it's just rearranged. The irony is this rearrangement of your anatomy actually helps to immediately improve patients with their diabetes. And that's the overall benefit for this procedure.
So what are the risks and complications of this procedure?
The risk in itself includes to create this pouch, we're actually using a stapler and actually have an animation that we can go to. So similarly, we start with small incisions. Those small incisions are usually no bigger than the tip of your index finger, and we use adapters to look into the stomach. As we're looking into the stomach, or we're looking to the abdomen actually, we then isolate the stomach to create a small pouch. That small pouch, as I said before, is equivalent to the size of a large size egg. Again, nothing is removed from your body, we just separate the two. Okay? The stomach that's left behind still serves a very important function, which is what we call digestive juices to help to digest the foods later. We rearrange the anatomy such that the intestine is disconnected and brought up, hence bypassing the stomach in itself. It is this bypass arrangement that affords for the immediate resolution for some people for diabetes. And one extra benefit is really for patients with really bad heartburn. This procedure actually helps to allow that there's no reflux, if you will, or minimal reflux. The reconnection down below allows for nutrition to be absorbed later.
So this looks like a little more complicated than the last procedure.
It is extremely complicated, and for that reason, it's been around again for quite some time, and that's why many people are asking for different alternatives, such as that's why the sleeve has came into vogue.
So how many women actually do you see? Are there more women that seek bariatric surgery versus men, or?
Actually, we do. I would say for the bariatric population, we see easily over 70% plus of women versus men, period. Part of that has to do with our genetics, not just being women because of the estrogen, but also how we are built. Men tend to have more muscle, and muscle itself is what we call metabolically active. It affords them to lose weight quicker. So I usually tell patients, female patients, by no means compare your weight loss to that of a man because of those differences.
And so then even with the surgery, it's not like a one-fit option. So you would discuss all these different options with
Absolutely.
women?
In fact, to really make the best decision, I usually ask patients, tell me your top 3 desires in terms of getting your weight loss surgery. Is it to cure your diabetes or potentially? Is it to, hey, I need to lose a certain amount of weight by a certain time frame? Because most of these procedures, it is just a tool. It cannot change your behaviors long term, and more importantly, you always have the risk of weight regain. Usually it's about 25 pounds after 5 years. So we really have to focus on habits, choosing wiser meal options, and never forgetting to be fairly active with exercise of choice, if you will.
So if someone does choose to go with the gastric bypass procedure, how much weight would they expect to lose?
Great question. So rather than say, oh, you lose 100 pounds off the bat, that is not necessarily the case. The weight loss from someone who starts at 400 pounds will be different from someone who starts at 200 pounds. So we look at a word called percent excess weight loss. It means that if I'm 5 feet, I'm supposed to weigh 120, but I'm 100 pounds overweight, that's what we're capturing, the 100 pounds overweight. So out of all 3 procedures, on average, you can get anywhere between 70 to 90% excess weight loss with the bypass. Why? There's really 2 portions. You get the malabsorption and the restrictive. As a result, you get the most weight loss up front.
This is really great information. We do need to take another break, but we will continue this discussion when we return in just a moment.
Thank you.